This presentation was made by Jenna
and Erica.
To start off, we are going to ask our big question, which was, how does Botox control hyperhidrosis?
The body system that affects both Botox and hyperhidrosis is the nervous system.
Those are nerves, by the way.
The nervous system is made up of the brain, the spinal cord, and lastly, all the nerves in the body. The brain is made up of 1 billion neurons. It is where all information is processed and responses originate. This is where messages for nerves are sent out, and it connects to the spinal cord. The spinal cord is a long, thin mass of bundled neurons that carry information through the vertebrae column. This consists of 3 parts: the cervical vertebrae, the thoracic vertebrae, and the lumbar vertebrae. In the lumbar region, the spinal cord separates into a bundle of individual nerves. Nerves are bundles of axons that act as information highways to carry signals between the brain and the spinal cord to the body. Like 2 phones sending messages back and forth, the brain sends messages back and forth between nerves and the body. This is a 2-way system. The neurons in the brain send signals to the spinal cord, which then sends signals to each individual nerve. From there, it sends it back to the spinal cord and back to the brain. The part of the brain that is responsible for sending messages for the body to sweat is the hypothalamus. Sweat glands are controlled by the sympathetic nervous system, whereas the autonomic nervous system is in control of sweat with emotions, such as that fight or flight feeling. The reason why we sweat is thermoregulation, thus maintaining an even body temperature. But sometimes people sweat excessively, and this is called hyperhidrosis. Hyperhidrosis is abnormal excessive sweating that is not necessarily related to heat or exercise. Hyperhidrosis can affect anyone, and it usually starts in childhood. Hyperhidrosis affects around 3% of the population in Canada, and around 5% globally. This neurological dysfunction tends to occur in areas where higher concentrations of excrete glands are, such as the palms in your hands, the soles in your feet, or your armpits. In a healthy body, there are around 2 to 4 million sweat glands. The majority of these glands are called excrete sweat glands. These glands are activated by the nerves. They secrete an odorless scent and produce a clear fluid that helps the body to control its temperature by promoting heat loss through evaporation. In a healthy human, the brain sends messages to the nerves telling them when to sweat, but in hyperhidrosis, these nerves are kind of left on that on switch where they don't stop sweating. There are 2 different types of hyperhidrosis. The first is primary focal. The second is generalized secondary hyperhidrosis. The most common form of hyperhidrosis is primary focal. These nerves become overactive even though they have not been triggered by physical activity or a rise in temperature. The second type of hyperhidrosis is generalized secondary. This occurs due to medical conditions like diabetes, thyroid problems, and nervous system disorders. This condition can be random, but it is most likely caused by a health condition or by being passed on. The only form of hyperhidrosis that can be caused due to hereditary genes is primary focal. And secondly, the only form of hyperhidrosis that can be caused due to health conditions like diabetes is generalized secondary. Here's something good. Hyperhidrosis is not life-threatening, but There are some reasons why people may want to get rid of it. The first reason is infections. People who sweat profusely are more prone to skin infections. Secondly, social embarrassment. Although sweating is normal, people may become self-conscious and lose self-confidence when they sweat more than usual people. There are many tests that can be done for hyperhidrosis, such as a blood or urine test for overactive thyroid and low blood sugar. You can take an iodine starch test, a skin conductance test, or a thermoregulator sweat test. Although it is not life-threatening, many people wonder if there is treatment for hyperhidrosis, and there is. After consulting with a doctor, they may first prescribe prescription-strength antiperspirants, and if that doesn't work, they may offer Botox. In severe cases, a doctor may suggest surgery, either to remove the sweat glands or to disconnect the nerves.
Botox is a drug prepared from the bacterial toxin called botulinum. It is used medically to treat certain muscular conditions and to cosmetically remove wrinkles. It does this by temporarily paralyzing the facial muscles. When the procedure is done correctly, the Botox blocks the message from your brain and keeps the muscles from moving. The muscle that was injected can no longer contract until the Botox wears off. Botox is made from a neurotoxin called botulinum. It is produced by the bacterium Clostridium. It prevents the release of the neurotransmitter acetylcholine from axon endings at the neuromuscular junction. This is the chemical structure of botulinum. These are the other chemicals found in Botox, but I'm not really sure how to pronounce them. Botox can leave you with many serious side effects, like pain, swelling, bruising, headaches, flu-like symptoms, droopy eyelids, dry eyes or excessive tearing, uneven eyebrows, and drooling. The main toxin in Botox, as mentioned, is botulinum. The reason it is dangerous is because it can cause a person to be paralyzed and in some cases even kill them. Most Botox injections only take a couple of minutes, but this all depends on what is being treated. The Botox is injected with a thin needle into a specific muscle. Generally, the effects of Botox will appear 3 to 7 days post-operation. Botox should last for as long as 6 months. Botox is priced per unit. On average, each unit will cost a person $10 to $15. For people with hyperhidrosis and are wanting to get Botox in their armpits, it can cost up to $1,000. If Botox is injected into a vein and the Botox travels to other areas of the face or body, temporary paralysis may be the result. Overuse of Botox can cause a person's muscles to become so weak it can no longer support the flesh on their body. Their whole face will droop down. They may also experience trouble swallowing. They will struggle to keep their head up. Once you receive Botox injections directly into the area of your body that commonly sweats, your overactive nerves become paralyzed. When your nerves can't send a signal to your sweat glands, you don't sweat. However, this only happens to the places where the Botox was injected. And that is how Botox controls hyperhidrosis.
Thanks for watching.
Oh god. We're not